The Ghana Health Service, in collaboration with the Ghana Education Service, is embarking on Human Papilloma Virus vaccination exercise targeting young girls from age 9 to 14. The nationwide exercise is expected to protect young girls against cervical cancer and genital warts, among others, while securing a better future for the younger generation. A visit to some schools in Accra saw young girls taking vaccines. Some of them spoke to the Ghana News Agency.
In future, I want to be safe. That's why I took the vaccine. And my parents allow me to do it.
We were told that the vaccine will protect us from cervical cancer. So I decided to take the vaccine so that I'll be free from the sickness.
I was afraid, but I took it normal and I sat down and they inject the vaccine. I believe that in the future, nothing about cancer will happen.
Mrs. Patience Adams Brown is the School Health Education Program Coordinator, LECMA Education Directorate.
The vaccination is ongoing as girls are ready and they are taking the jab. It is safe for them and it will protect them from genital warts and cervical cancer in the future. Students are supposed to eat well before they come in. And then students who have various or who are sick are not to take it. There will be headache, fever, or abdominal pain. With all this, they confide in the teacher, you, the parents, or the school nurse within the school. They have given them ways to manage the situation.
She says children and parents have been well informed and educated about the safety of the vaccines.
Parents, stakeholders involved, please get informed and know that our future leaders must be safe, and that is why we are doing this nationwide exercise. After this exercise, it shall be available in all health facilities. So students or girls between the ages from 9 can go in and take their jab. It is free.
Cervical cancer is a disease caused by the human papilloma virus, which spread primarily through sexual contacts. It remains one of the leading cancers among women in Ghana, with approximately 3,000 women being diagnosed every year. Unfortunately, 70 to 80% of them die within the first year of diagnosis. Dr. Selom Kuchuati, Program Manager, Expanded Program on Immunization, made an urgent appeal to parents and guardians to embrace the national HPV vaccination program, describing it as a critical tool in the country's fight against cervical cancer, a disease that kills thousands of Ghanaian women every year.
So it's very important we vaccinate our young girls because we want the girls to grow up in a future free of cervical cancer. In fact, we are lucky because cervical cancer is one of the few cancers that we have been able to identify an organism, which is a virus, to be the cause. There are so many cancers, for instance, breast, that we are all talking about, but they don't have a definite cause for which we can actually go and tackle. But with cervical cancer, we are lucky. We have a virus and we have a vaccine that has been in use for almost 20 years. So it's not a new vaccine that has been introduced from somewhere or is now being trialed in Ghana. No, we've actually had this vaccine for over 20 years. And it's very important to immunize our girls because we want to make sure that they grow up not having cervical cancer.
Dr. Kuchuati expressed worry that most of the cases are detected late as the disease often shows no symptoms in its early stages.
Many women do not participate in cervical cancer screening at all. So the first time they find out they have cervical cancer is when the symptoms have started and it has already gone quite severe. It has spread to probably the liver, the lungs, the bladder, the bowel and things. And it already has a debilitating effect on them. That's the time they find it. And at that stage, there is very little we can do but to give you treatment to improve your quality of life and make your passing less painful. That is what tends to happen. So it's important that we try and prevent it from getting to that point at all.
She dispels the myth and misconception about the vaccine and expressed the need to protect the country's young girls within that age group to secure their future.
Government has committed so much money to this. Contrary to what some people think, nobody came to donate the vaccines to Ghana. It's not free. We are using our taxes to pay for it. So government is investing the same way government invests in our little babies. When we give birth to them, we take them for the weigh-in. It's the same way government is looking to invest in our girls to make sure that in the next 5 to 10 years, cervical cancer cases will drop significantly. Please go out and get the vaccine. The vaccine is safe. There's no way the government will bring in something that will be against your future. We are all working towards making sure you grow to be able to achieve what you've set out to achieve. I'm sure everybody or every one of you has an aspiration. You have a dream of going somewhere. We don't want you to get to the point where you're about to achieve these dreams and the dreams are being cut short by cancer. So please go out when the teams come to your place. Please allow them to give you the vaccine. And as we stated earlier, if you have the vaccine and you feel you're not feeling well, or you have anything you feel is an untoward feeling you have, don't wait to say you are going home. You can tell your teachers, they'll take you to the nearest public health facility and be taken care of.
Cervical cancer.
Away! Get vaccinated and be safe for the future.